I came here as a student for a placement for a month and just fell in love with working in the prison. And one of the reasons I really like it is it's that you really have to amend your practice to the prison environment, so you've got to be quite creative in your practice. I like the challenge of that.
We work alongside a multidisciplinary team, so we work with the discipline staff, healthcare assistants, nurses, psychiatrists, psychologists, to get the right support for them.
You get involved in all kinds of things. It's very, very interesting. If you love learning, come to the prison.
The inpatient unit is a particularly unique environment. We work from all different aspects of physical, mental health and end-of-life care. So it's a complete different range of people. I can be speaking to somebody that's relapsed into mental health, and then we could be looking after somebody that's dying from cancer.
So much to do, so much to learn. Any minute we can get an emergency call at any time, and within 2 minutes you could be saving someone's life, dealing with a nasty wound, someone ligaturing. So you have to think on your feet quite fast, and keeps you on your toes.
Level 2, cell 32, acknowledge.
Looks like that's received.
You've got the officers with you if you feel like you need them. You've also got screens if you want them in a screened room to speak to people if you need that. There's other safety options so that you don't need to feel unsafe at all. The officers are the first point of call because if they've noticed any changes in them, they're the best people to ask because you see them every single day.
I work with a lot of people that have, yes, often done some quite awful things, but have also often had quite awful things happen to them. And, being able to, maybe for the first time, get somebody the help to deal with that is, it's nice to be a part of that, really. Once you see the person and realise that they're not the thing that they did, not every single thing about them is bad. I think it's easier than you think to look past what people have done.
Any new starters, obviously there's an induction process regarding the prison, so regarding the security aspects. We also get you shadowing nurses here, and that will last basically as long as it takes until you feel confident to be let loose on your own. There's the high walls, there's barbed wire, we've got guard dogs, prison officers, so like I say, for your first 2 weeks it can be a bit daunting, but I can assure you that after 2 weeks of walking around you don't even notice they're there.
A job came up here. I thought security, crazy job. That's just me. Yes, let's go for it. So I did. 9 years later, I'm still here. Such a close-knit team. Friends for life, absolutely.
Every day is different. Some days are harder, some aren't. But I do like working here. And I can't see myself really anywhere else.
It's huge, but I love it. I do. And part of the reason I love it is because no 2 days are the same. Never know what I'm going to come into.